All right, hi everybody. I'm going to demonstrate a scalp IV insertion. This will be for your babies up to 12 months who were just having a really hard time getting a peripheral IV on. It's not necessarily an emergent thing. If you're in an emergent situation, go ahead and drill. But this is for your baby that really needs fluid or medications, and you really need to get those on board. So you are going to start with some friends to help you. I think the hardest part of scalp IV insertion is talking to the parents and convincing them that this is what needs to be done. Obviously, it's going to be easy on your baby without a lot of hair, but if this is a situation that you really need to get this IV in, you're going to probably have to shave some hair. So the best candidate is going to be your little bald babies, but I'm not afraid to shave the little hair on kids, on babies. So what you're going to do is gather all your supplies. You are going to need a rubber band. And that's going to be your tourniquet. You want to put a piece of tape on it so that you can get it off the baby's head. You are going to use a 24 gauge, so it's the smallest we carry. And I think the easiest one to use is the 0.56. I think the shorter the better on this. You're going to have your tape ready to go. You're going to have your tegaderm, another syringe if you want to get some blood work, okay? So you're going to get your baby nice and secured. Mom and dad can help. Put a little pacifier in, some sweeties maybe. Positioning is super important. They have to be supine. They can even be a little bit of Trendelenburg position. Your best sites are going to be your frontal, temporal, and there are some occipital. I find the temporal are usually the frontal are usually the best. There is a temporal as well. What you want to be careful with that temporal though is you have a temporal, they have a temporal artery, and you want to make sure that you're not hitting that artery. So you're going to look for sites. On this particular baby, we've got a pretty good frontal. All right, your tourniquet is on. You're going to get your swab and you're going to wipe. Okay, and you're always going to head with every IV towards the heart, right? Okay, so you're going to find your vein, okay? You're gonna put some tension on the head, and this is not obviously gonna go in, and you are gonna cannulate. You're gonna go a little bit more superficial than you would with a vein, like the arm or the leg, because there's not a whole lot of tissue above there. So you're gonna cannulate it. Once you are in, you are gonna notice that this is gonna bleed a little easier than a peripheral for the most part. So you want to go ahead and put some tape on there. If you're going to get some blood work, go ahead and get some blood work initially. All right. Put a little tourniquet on there. When you're done with your blood work, and you are going to maybe get your cap off. Oh yeah, that's not going to happen. All right, you're gonna get your cap off and you're gonna hook it up and you're gonna have this pre-flushed and you're gonna flush. You may see a little blanching, but you shouldn't see too much. And this should flush pretty easily, maybe a little bit more pressure than an arm or a leg. Alrighty, once this is in, you're gonna secure it. You may even need to get some 2x2s and build up this site back here to make it nice and secure. Once it's taped in there, okay? Which also means you might have to shave a little bit of hair off of another site there.